We will now demonstrate the dressing, cap, and extension change, as well as flushing and PICC catheter removal. The nurse will explain the procedure to the patient. She will then wash her hands and dry them with a paper towel. The supplies will be assembled on a clean, dry surface. She will remove the air from the saline flush by holding it in a vertical position, pulling back slightly on the plunger, then depressing the plunger to expel the air. The saline flush is then attached to the positive pressure cap, and the cap is attached to the extension set. Holding the cap inverted, prime the cap in the extension set, tapping the cap to release any trapped air. Tape the junctions and set aside for later use. Open the dressing kit. Remove the masks. Place one on the patient and one on the nurse. Secure the extension set with a single piece of tape just below the catheter extension set junction. This keeps the catheter from getting pulled out during the dressing change procedure. Put on a pair of sterile gloves. Open the sterile barrier and place on the work surface. Place all other necessary supplies on the sterile barrier. At this time, open the package with the stat lock securement device and place on the sterile field. Loosen the outer dressing, working inward from all edges. It may be necessary to use alcohol swabs to assist with loosening the dressing. Once the outer edges are loosened, stabilize the catheter and remove the outer dressing, pulling in the opposite direction from which the catheter exits. Soak the adhesive on the stabilization device using several alcohol swabs, then carefully remove the device. Inspect the site for redness, drainage, and swelling. Remove the gloves and cleanse hands with hand sanitizer. Put on a new pair of sterile gloves. Use the alcohol swab stick provided to first defat the skin and remove excessive adhesive. Activate the ChloraPrep swab stick by squeezing the handles on each side. Pat the palm of your sterile glove to soak the pad with solution. Using firm pressure, scrub the skin around the catheter exit site, covering an area equal to the transparent outer dressing. Scrub for 30 seconds. The ChloraPrep solution should be allowed to dry for 60 seconds on the skin. The outer dressing will adhere better if the ChloraPrep is allowed to dry thoroughly. For demonstration's sake, we will proceed with the dressing change. At this time, skin prep may be applied to the site if needed. This is an optional step. Next, the stabilization device is applied. As you will notice, it's helpful to close the wings on the hub of the catheter prior to removing the adhesive strips on the bottom of the device. It is also helpful to apply 2 to 3 steri-strips between the device and the catheter exit site to keep the catheter from migrating out in this area. Apply the transparent dressing over the site at this time, centering the exit site in the middle of the dressing. If gauze is used to apply pressure under the dressing must be changed in 48 hours. A tape strip should be applied to the bottom of the dressing where the catheter emerges to prevent the dressing from pulling up in this area. At this time, remove the sterile gloves. Measure the external portion of the catheter, that's the part that can be inserted, as well as the upper arm circumference, which is the midway point between the exit site and the axilla. Label the dressing with the date and these measurements and record them on the flow sheet and in the progress note. It is important that the mid-arm circumference is measured at the same point each time to give accurate measurements to compare to the previous dressing change. Cleanse the junction of the PICC line and old extension set with 3 alcohol swabs, wiping for 1 full minute. If it is an open-end catheter, apply the clamp. If it is a valve catheter, there is no need to clamp. Remove the old extension from the line and attach the new extension and cap. Check for blood return, then flush the catheter using a push-pause motion, stopping before the last half milliliter of solution is inserted. Tape the junction of the new extension and catheter. If the catheter does not flush easily, it may be necessary to redress the site, as there may be a kink in the catheter.